Well, good morning, everybody. We're going to reconvene the open session. We're on item 3, approval of the March 19th timed agenda. What's the pleasure of the committee?
Move it.
Moved by Jones. Seconded by Taylor. Any discussion on the motion? Seeing none, all in favor say aye.
Aye.
Opposed, no. Motion carries. Item 4, executive report. Ms. Bailey-Cremens and Ms. Lum, please.
Good morning, Mr. Chair, members of the committee. Donna Lum, CalPERS team member. Before I get started with my update, I'd like to extend my congratulations to you, Mr. Fechner, for your re-election as the chair of this committee, and congratulations, Mr. Rubikova, for your election as the vice chair of the committee. We look forward to working with you throughout the year on the many critical and important items that this committee hears. So I have a couple of quick updates that I'd like to share with you. The first is around our CalPERS benefit education events, also known as our CBs. We did have a CB here in Sacramento, and it was held on March 1st and March 2nd at the Sacramento Convention Center. We had nearly 3,000 attendees at this event. And Sacramento does draw a large crowd, and our teams were very well prepared. All of our members were able to get into the classes that they desired, and they were also able to meet with our team members that were in the exhibit hall. Our team was very pleased to see several of our board members in attendance, and I would again like to extend my thanks and appreciation to all of you that did attend. It's nice to have you there, and I know that our members also do enjoy interacting with our board members. We do have another CB that is scheduled for this weekend. It's Saturday, March 22nd and March 23rd, and it will be held in Eureka at the Red Lion Inn. This is considered to be one of our remote locations, and that's because the nearest office, the CalPERS office to Eureka, is here in Sacramento, and it's about a 5 to 5.5 hour drive. We have held an event in this area previously. The last time we were there, we had about 425 attendees. I'm happy to share with you that as far as pre-registration this week, we have over 800 members pre-registered to attend. So I anticipate, like we have seen throughout all of last year and the early part of this year, that RCBs are continuing to be well attended. In addition to that, we have completed the new schedule for the CBs. I believe each of you has a copy of the schedule there. This schedule goes from now through June of 2020. We have 6 CBs that are scheduled between now and the end of August, and then we will pick up with the CB schedule in January with 6 additional CBs scheduled from June of up to June of 2020. And you can see on the schedule that we do have a wide range of locations. We always attempt to get to the very large metropolitan areas as well as some of our more remote locations. We do have the schedule posted on the CalPERS website, and members are able to go there and see the dates and location and the schedules as well. And we also do have a couple of copies that we have printed in the back room for anyone in attendance that would like to have one. Next, I'm happy to also share with you some good news on an accomplishment of a body of work that has come before this committee over the last year. The Office of Administrative Law has approved our regulation for the definition of full-time employment, and the regulations will be published by the Secretary of State on April 1st. This was a significant accomplishment. What it did is it further solidified the board's previous resolution on this regulation and therefore strengthened our position. And then lastly, I'd like to update you on a presentation that our team members recently gave at the CalPERS General Assembly on March 4th. For those of you that are not familiar with CalPERS, it is the California Association of Public Retirement Systems, and its membership is primarily made up of county and city retirement systems throughout the state of California. The mission of CalPERS is to provide education and information sharing opportunities to enable retirement systems to share information to be able to manage their public pension plans. The General Assembly was attended by more than 300 members, or 300 attendees, consisting of trustees of systems, board members, administrators, chief executive officers, and pension leaders, as well as conference sponsors. And there were over 31 retirement systems in California that were represented at this conference. Anthony Sweeney from our Benefit Services Division and Kelly Aoki from Policy Research and Data Analytics Division participated on a Lean Six Sigma panel. Anthony was able to share how his team has used Lean Six Sigma methodology to implement process improvements to the disability retirement determination process, which has resulted in more than a 33% improvement in their average determination timeliness, and that they have been able to sustain these process changes for over 2 years. He also provided materials on how his team has used Lean Six Sigma to reduce the average amount of time that it takes to pay a pre-retirement survivor benefit, and the average time has been reduced from 27 days to 17 days. So as you can imagine, in the audience that was at this conference, there was quite a bit of interest in learning how Lean has been able to enable CalPERS to become very efficient and to also enhance our service delivery. Kelly also shared the efforts that CalPERS has undertaken to implement Lean into our business culture. And I think one of the most important things that she did is she discussed the importance of getting to the heart of the process improvements through employee empowerment and engagement to immerse a Lean culture into our organization. And we are very well on our path with regards to our Lean framework and our maturity. As I mentioned, the attendees were very interested in our success. And I also wanted to share with you, both Kelly and Anthony will be hosting a workshop on CalPERS Lean Framework, our implementation, and our successes at the CEM conference, which is held in May. And I think you know that the CEM conference is very well attended by pension systems from around the world. So this will give us an opportunity to really share and exchange information with regards to the many enhancements that we've had centered around customer service and our Lean implementation. And that completes my update, and I'm happy to answer any questions you may have.
Thank you. Ms. Brown.
Thank you, Mr. Chair, and congratulations. I have been attending CBs around the state as you guys have them. I know how much your staff likes to attend them, and I can understand why, because these future retirees are in a very good mood. They're very close or several years away from retirement, and they're really there to learn all their options that are available to them. And I would like to say that I was most recently at the CB in Sacramento, and your speakers were very dynamic. They used humor to impart bad news, especially about being a divorced spouse and you can't collect your ex-husband's Social Security unless he's deceased. And he used some humor about that. So it was very good. And I also thought your staff was great when you had a lot of Q&A, a lot of microphone running, me of Phil Donahue, but when there was a question that was more personal, your staff was very quick to say, let me get someone to help you, we'll answer that one-on-one, so we don't necessarily need to understand the personal issues that that person is facing. But all in all, it's just a wonderful experience for not only the future retirees, but I think your staff enjoy it too. It's just a real good experience, and people love coming. I'd be happy to also, if you could share some of the comments that we get back to the board, just though I know you have these comment sheets that come back. I assume you assemble them and put them together. Would love to see those as well. So
certainly, we do collect a lot of survey and feedback information at the CB, and I'd be more than happy to bring that back and share it with the committee. Ms. Brown, thank you very much for your comments. Obviously, our team has been working at this for many, many years, and I do want to acknowledge the fact that it's more than just the customer service teams that put on these CBs. We have a lot of support from our events management and public affairs. We have a lot of support from different program areas throughout CalPERS, including the information technology branch. So it really does take a lot of effort to put this on. And as you mentioned, you can certainly see when our team members are interacting with our members face to face, there is a great sense of pride in the work that they do, knowing that they are helping our members on very important decisions. So I appreciate your comments, and we'll be sure to share that with the team.
Thank you.
Thank you. Ms. Taylor.
Thank you, Mr. Chair. Ms. Brown stole my thunder, man. But I wanted to reiterate, I had 2 comments, one on the customer service program you're working on, but also on the CBE. It's my first. I haven't attended any because retirement seems so far away, but it's not really now that I think about it. So I attended it as a retiree, future retiree, and I thought, and I also found it very enjoyable, very informative. The main session that Marcy spoke at, that you took a lot of questions. I just thought that was amazing that you took all those questions. I was able to also help with a lot of those folks are my members, and I was able to go talk to them as well. And then I attended a session for retirees in the under 10-year range. But it was very informative, and I just wanted to congratulate you on how well run it was and organized and all of the enthusiasm. And I learned a lot of stuff that I didn't know. So, and it makes me, I've heard from my fellow workers that when they come in to retire, right, and they made an appointment with CalPERS, they feel very taken care of. And I can see that from the CBEs transferring very easily into when they have to be one-on-one with our retirees to talk about, okay, this is your time, this is how, So I thought it was just a wonderful experience. And then secondly, I wanted to congratulate you on your new customer service program that you guys have launched and have been successful with and are now rolling out to share with other organizations like SACRS, which is, I'm sorry, CalPERS, not SACRS.
Thank you. Thank you for your feedback. Yes, the entire team is very excited about our lean initiatives and our framework. Certainly, we've seen a lot of positive outcome, and we know that there is more that we can do. And being prudent and looking at how we can be more cost-effective and more efficient. These have been proven ways that we can do that without sacrificing the delivery of services to our members and employers, which is an important piece. So, thank you again for your comments.
Thank you. Mr. Miller.
Yeah, I also share the applause for the CB. I was at the Sacramento one, and I wanted to add 2 other things. I was really, it's a great opportunity for our members, for our staff. I enjoyed it, but I think it was also, it was really nice to see some of the retiree associations there and how well received they were and what a valuable opportunity that was for our members and our providers. They were well staffed, a lot of interest, and a great opportunity for our members to interact directly with them, and then be able to walk, a few yards away and talk with our staff and say, wait a minute, here's what I heard here. Is that the real deal? What do you think? And talk to their associations, go to classes. I mean, it was just, they continue to amaze me as a really, really gold-plated opportunity for our members, staff, providers, associations, everybody. So kudos again on that.
Thank you, Mr. Miller. And certainly our exhibit halls are very well attended. We have great partners that are with us at each of the CBs. And again, it's just another opportunity for our members to get insights and information as they're moving through the retirement process. So thank you.
Thank you. Seeing no other requests, Ms. Bailey-Crimmins.
Good morning, Mr. Chair and members of the committee. Leanna Bailey-Crimmins, CalPERS team member. I would also like to congratulate Mr. Fechner and Mr. Mrubakava on your election to be chair and vice chair of the Pension Health Benefits Committee. The team look forward to working with you throughout the next year. Today, I have 3 items to highlight. First are CalPERS enhancements in support of open enrollment for 2019. Second, our recent steps we are taking in relation to CalPERS to make it easier for members and employers to do business with the CalPERS Health Program. And lastly, I'd like to highlight just a few items that we will be discussing today here at the Pension and Health Benefits Committee. So consistent with previous years, CalPERS's 2019 open enrollment period will be from September 9th to October 4th of 2019. We are well underway to have a very comprehensive outreach effort, and CalPERS wants its members to have readily accessible information at their fingertips to make sure that they're making informed decisions when it comes to their health plans. And as you are aware, last year, CalPERS received very high member satisfaction scores and positive responses for our open enrollment app. And members were able to view their health statements online, compare rates, and for retirees to actually make health plan changes. So I am pleased to report that our app will again be available for the 2019 open enrollment period. But in addition to the app, we are changing the name of the current Find a Medical tool to Search Health Plans. And this will include member requested functionality. So between now and open enrollment, we'll be sharing what that functionality is going to pertain. And then I'm also excited that we are going to be launching a health provider directory utility. Once implemented, members will actually have the ability to look up their personal physicians and find which health plans their doctor participates in and compare the rates. The provider directory is expected to be completed by the end of the calendar year in 2019. Members, as you're aware, have qualifying events. They have babies that get married out throughout the year. And so this will allow them to have educated information at their fingertips. Today, a member has to actually go to a health plan's portal, web portal, and look up a doctor. So this enhancement will provide one single pane of glass and aggregate all that information so our members can go to a CalPERS site and look that information up. So it will simplify the process and will improve the member experience overall. And with any enhancement, we push the envelope, so we are pushing to have it available for open enrollment. So I will be keeping you apprised of the project update as it progresses throughout the year. But we're very excited about this opportunity. For the second item, last year, CalPERS improved its enrollment forms, and it did that by taking multiple forms and creating a single form. We also created fillable PDFs, which are available online to make them more user-friendly. And because our members and our employers are at the heart of everything we do, based on recent feedback, they want more. And so now employers may accept electronic signatures on all their health enrollment forms. This improves efficiency, and it just helps overall the experience when dealing with CalPERS. So we were excited about that. And then lastly, just some highlights what to expect from today. Under consent, the 2018 open enrollment results are now available. 6.4% of our members changed health plans this past year. It is comparable to 5%, which was made in the prior year. This month, we have also included the first quarterly PERS Select value-based insurance design. It's an implementation report. And just as a reminder, we just launched this program January 1st, so the data that you're seeing is about a month and a half's worth of data. These reports will be provided to this committee quarterly throughout the year, and you'll receive your next one in June. And finally, for your action today is a selection of the third-party administrator for our self-insured PPO plans. And just as AKA, also known as PERS Choice, PERS Select, and PERS Care. And hot off the presses, we just found coming into this meeting that the Anthem Sutter negotiations were successful, and so our members that have the Anthem PPO and HMO will still be able to see Sutter docs, and that contract was inked last night, and it will be valid all the way through 2022. So that has been something that I know the board's been keeping an eye on, so I wanted to share that good news. And Mr. Chair, that concludes my opening remarks, and I'm now available for any questions.
Very good. Thank you. Seeing no other requests, moving on to item 5, the action consent items. I've had a request to pull item 5C from the consent calendar. Seeing no other request to pull anything else, what's the pleasure of the committee?
Move approval.
Moved by Brown, seconded by Taylor. All in favor say aye.
Aye.
Opposed, no. Motion carries. Before we go on to the information consent items, let's take up 5C, the Pension and Health Benefits Committee delegation. Mr. Cobb, it was your request. You gotta push your button, sir. There you go. There you go.
Thank you, Mr. Chair. I just think that this item, the reason I pulled this item is because of the language being proposed in the delegation regarding budget change proposals coming to the committee. I think, I'm not saying that they shouldn't come to the committee, but I think that there should be some conversation at the staff level between CalPERS and Department of Finance to talk that through and work out the process before the delegation is approved. So I'm just asking that we hold this over for a month and have those discussions and then bring it back as appropriate.
Mr. Chair, thank you, Michael Cohen. And we're happy to have those staff conversations, but I would say this is pretty standard operating procedure for every public board in the state in terms of approving their budget proposals before they go to finance. So State Lands Commission, the Commission on State Mandates, Franchise Tax Board, all of these organizations sort of discuss their budget proposals. Otherwise, the alternative is really for us to be submitting things to finance that you have no idea about, which doesn't seem like a particularly good alternative. That being said, these recommendations on the delegations come to the full board in April, so I think we can have conversations before you act in April. But that being said, this delegation is very much consistent with every other public board that I'm familiar with in California.
Thank you. Anything else, Mr. Cobb?
No.
Okay. All right. Thank you. This committee's gotten very important. Michael Cohen testified in front of us. Okay, seeing no requests, item 6 is information consent. Having no request to move anything takes us to item 7, which is the preferred provider third-party plan administration contract award. Ms. Donison.
Mr. Chair, members of the committee, this is agenda item 7A, which is the PPO procurement, final evaluation, discussion, and result. I'll just give me a moment. Thank you. So, good morning.
Good morning.
This item provides the final results of solicitation 2019-8505 and recommends the contract award for the preferred provider organization 3 plans for 2020 to 2024. And as Lana said, that's PERS Care, PERS Choice, and PERS Select. We are going to present the finalists and ask you to make an award. Today, we will cover the timeline for the procurement, where the firms stand in relationship to each other through all 4 phases of the procurement, and then offer you the final evaluation upon which we will ask you to make a decision. The procurement timeline shows that we began in August for phase 1 and 2, which carried forward through December, and then in in January through March, we finalized the procurement through phases 3 and 4. For the phase 1 approach, we asked for the minimum qualifications for the bidding firms, and we had 5 who bid this procurement. The minimum quals required that they be licensed in the United States, that they administer both a basic and Medicare set of plans, that they had to have ability to service our members who live throughout the United States and worldwide, and they must have the ability to process 50,000 claims per week. The firms that met the minimum qualifications, the firms that did not meet the minimum qualifications was Blue Shield of California and a joint venture by Sutter and Anthem. Aetna, Anthem Blue Cross, and United Healthcare all did meet the minimum requirements, and they advanced to phase 2. In phase 2, we asked for information on each plan that included the geographic coverage and the provider networks, the fee-for-service billed charges discounts, and the administrative services fees. And now I'd like to refer your attention to attachment 1, which is the geographic and provider coverage areas for the 3 firms. So for those in the audience, if you would turn To that attachment, you will see the coverage areas for these three firms. So in attachment 1, we'll start with the Anthem provider network. Anthem has the broadest geographic coverage with 82,000 approximate contracted providers. If you look at the second map for Aetna, it has a geographic coverage area that is broad in California, but the number of contracted providers in these counties is around 54,000. And then if you look at the final map in your attachment 1, United Healthcare also has broad geographic coverage with approximately 43,000 providers. Continuing on, looking at the fee-for-service billed charge discounts, Anthem ranked at number 1 at approximately $1.4 billion. Aetna ranks second at approximately $1.3 billion, and United Healthcare ranked third at approximately $1.1 billion. We used the actual discounts for 2019 so that we could then estimate what the discount rates would look like for 2020. For the administrative services fees, we asked for all 5 years of administrative service fees for 2020 to 2024. Anthem did have the lowest fees for the basic plan, and Aetna had the lower fees for the Medicare plans, and the United Healthcare fees were higher than in both categories for either of the plans. So moving on to the final results in Phase 3 and Phase 4. Carl, could you advance? Thank you. In Phase 3 and Phase 4, we looked at the performance measures, the fees at risk for our performance measures for both plans. I will say that at the end of December, United was advised that they would not be advancing to Phase 3 and 4, so the two successful firms that did advance were Anthem and Aetna. So we looked at the performance measures and the fees at risk, and we looked at the final financial offers, which included renegotiated administrative service fees by both plans, and they negotiated downward, and then the firm's contract acceptance. So part of Phase 3 was that they had to agree to accept the contract on CalPERS terms, and they both did so. So for the scorecard, which I'm going to show you in a minute what the final results are, the scorecard was a combination of the provider networks and the coverage areas, the performance measures and the fees at risk, and who was willing to put more or less on those on performance, the fee-for-service billed charge discounts, the administrative services fees, combined billed charge discounts minus administrative fees, and then contract acceptance. So that is the criteria around which we evaluated all vendors, coming down to two competing vendors, Anthem Blue Cross and Aetna. So at this point, I'd like to show you the final results for 2019. And as you can see, the provider networks, Anthem scored higher. Fees at risk, Anthem scored higher. Discounted fee for service, savings, Anthem scored higher. Administrative services fees, combined Medicare and basic, Anthem scored higher. And then the overall savings of $78 million made Anthem the number one ranked firm. I will note that both Aetna and Anthem accepted our contract. And many thanks to all the firms who went through this process, especially to those final three and then the final two. And with that, that concludes, one more slide, the 2020 results. Again, the same scorecard at about 64 million, which makes Anthem the number one ranked vendor. And at this time, I'd like to ask you to approve and award the contract to Anthem Blue Cross for 2020 to 2024. That concludes my presentation.
Thank you. Thank you for the presentation, and thank you and your staff for all the hard work. What's the pleasure of the committee? Mr. Jones.
Thank you, Mr. Chair. Move approval.
Second.
Been moved by Jones, seconded by Brown. Any discussion on the motion? Seeing none, all in favor say aye. Aye. Opposed, no. Motion carries. Thank you, Ms. Donaldson. Brings us to agenda item 8. 8A, retired member cost of living, Mr. Sweeney. His attempt to play hero for the day. Make a Superman shirt on.
Thank you, Mr. Fechner. Good morning, Mr. Chair and members of the committee. Anthony Sweeney, CalPERS team member. Congratulations, Mr. Fechner and Mr. Rubicava, on your appointments. Look forward to our continued relationship. Agenda item 8A is our annual information item on the cost of living adjustment, or more routinely referred to as COLA. And our retirement law provides for an annual cost of living adjustment to eligible retirees on the May 1st retirement check. And the cost of living adjustment is measured by the CPIU, or the Consumer Price Index for all urban consumers, which is specified in our law. A retiree becomes eligible for COLA in their second calendar year of retirement. Therefore, if you retired in 2018, you would not yet be eligible for a COLA. For the year ending 2018, the rate of inflation as measured by the CPIU was 2.44%. Approximately 95% of all our retirees contract for a 2% cost of living adjustment, so they will all receive at least a 2% adjustment. Those who retired between 2005 and 2015 had certain lower rates of inflation during that time, so they are entitled to 2.44%. Those other 5% of retirees who may contract, their employer may contract for a 3%, 4%, or 5% cost of living adjustment, will receive at least 2.44% up to their contracted amounts. In the agenda item, you'll find a helpful chart that shows a retiree, based on the year they retired, what they might be receiving and their contract provision. And this information has been shared with our stakeholders, and it's available for our members on our website and in the upcoming Perspective publication. We also have it on our IVRs and on the message of the month on the May 1 retirement check or direct deposit stubs, whether that's electronic or by mail. It will also be informative to the retiree. And that concludes my presentation, and I'm happy to take any questions.
Mr. Jones.
Yeah, thank you, Mr. Chair. Thank you, Mr. Sweeney. Good information, and I've been sharing this information with the retiree groups that I've been talking with as I travel around the state. One other request, though, could you comment briefly on the PPP, the Purchasing Power Protection Act, where some members get, in addition to this, they may get additional COLA. Could you comment on that, please?
Sure. So the Purchasing Power Protection Agreement or allowance works in conjunction with the cost of living adjustment, and those who have been retired for 30 plus years may have an additional component to their retirement check that includes PPPA to keep them up based on the contract 75 to 85% of their purchasing power. And when COLA is higher than the rate of inflation, say a 2.44%, that usually sees a reduction in the amount of PPPA that needs to be paid out. But there are about 16 to 17,000 retirees who also receive a PPPA amount in addition to the COLA. It stayed pretty steady. A couple hundred went out of the program, meaning they were getting paid a little bit, but the cost of living caught them up. And there was a few decreases in triple PA over the course of this year because they received more COLA, so needed less triple PA to keep up with the cost of inflation.
Yeah, and the 16,000 members, thank you for that information.
Yes.
All right, seeing no other requests, thank you, Mr. Sweeney.
Thank you.
Before we move on to item 8B, I want to go back and revisit 5C, which was an action consent item. We did not take action on that because Mr. Cobb asked to discuss that. So what's the pleasure of the committee? Moved by Miller. Is there a second? Seconded by Jones. Any discussion on the motion? Ms. Taylor.
So what's the motion? What are we talking about here?
The motion was the exact action consent on the Pension Health Benefits Committee delegation.
Chair Fechner?
Yes.
You can actually wait and take action on that item next month.
Okay. Very well then. Your motion has been withdrawn. All right. Then we're on 8B, summary of committee direction.
Mr. Chair, that was the only item that I had on my list.
Well, good. Item 8C, public comment. I have no request to speak. Anybody from the public wish to address the committee at this time? Seeing none, this committee is adjourned. Performance and compensation will start at 11:25? 11:25.